and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin. This morning we're going to be cementing upper and lower roundhouse restorations on mini implants on my patient Laura here. We did full arch mini implants after extracting teeth on her upper and lower. She's healing great. It's been about 6 weeks, maybe 8 weeks now since we did her extractions and implants. All the implants look fantastic. And here's the roundhouse restorations. I chose to use porcelain fused to metal roundhouse restorations here, and they look phenomenal in her mouth. I'm just trying these in here. We're going to try the bottoms in. Close gently together. The light doesn't work? Is that what you're saying?
Your light's good.
Okay. Yep. So you can see how beautiful the teeth look. And smile big for me. Gorgeous. Everything looks fabulous. Shatkin F.I.R.S.T Lab did a phenomenal job on these roundhouses. First shot. Today's the first time we're trying them in, and they look amazing. So we're going to go ahead and cement these. And I'm going to use the Shatkin F.I.R.S.T cement. I'll leave the bottom ones in there for a second. We'll cement the upper first. We're going to use the Shatkin F.I.R.S.T resin cement.
Go ahead and open.
And when you have multiple implants like we do here, oh, this is empty. Can you give me more? Sorry, here, I'll use a little of this. When you have multiple implants like this, the holes end up being a little bigger because you have angulation, so we got to make sure we take care of any angulation issues with the implants. But no big deal. So go ahead and bite together. I'm going to have her bite together, and I'll put a little cotton in here. Open for me, and go ahead and bite again, and just hold that nice and tight for about 5 minutes, okay? So we'll come back in just a minute, and we'll cement the bottom roundhouse as well. Okay, so now we've cemented her upper roundhouse with Shatkin F.I.R.S.T resin cement, and now we're going to do the same on the bottom. I'm going to put it back in one more time just to check the bite, and I'm going to make sure that it's seating all the way down on the gum line. Bite together for me. Open and bite. Looks really good. Okay, open. All right, here we go.
Get this on back.
Here's the Shatkin resin cement. And I mentioned a couple Monday Morning Minutes ago that we're doing more and more PFM roundhouse restorations now because we've had some zirconia restorations that have had some cracks years later. A piece of cement here. I'll get that out. Okay. All right, so we're going ahead and cementing that. Go ahead and bite together, nice and tight. Very good. And then I'll put this open again and bite again. Okay, perfect. Just bite nice and tight, okay? Another 5 minutes, then we'll clean off the cement. Okay, so we just completed cementing her lower roundhouse bridge. So now both of her roundhouses are cemented in permanently. Bite together for me. Absolutely gorgeous. Really nice and bright and white and pretty. And she just ran out and had a nice lunch and came back for us to just do final checks. What do you think, Laura? Are you happy with your teeth?
Yes, I am.
Let's have you take a look.
Oh, wow. That's awesome.
Did you suffer with your teeth in the past?
Yes.
With problems?
Yes, they were terrible.
What was going on with your teeth?
So I had bad teeth from, oh gosh, I got my first crown when I was like 20. And it didn't matter what I did, brushing, flossing. I think I had 2 or 3 crowns. I had 2 root canals and crowns. All my other teeth needed fillings or crowns. And I was tired of doing it. It's a constant battle. So I decided to come here and get my implants.
All right. And how was the process?
It wasn't bad. The surgery, obviously first, pull out the teeth I had, put the implants in, and my temporary. So it's been like 8 weeks now. Yeah, it wasn't too bad. The first week was a little sore, but after that, yeah, not bad. Just getting soft food for a while.
So you had some missing teeth on the upper left side and on the lower, and you had a bunch of root canals and some dental problems, cavities and things in your mouth. So we opted to remove everything. And this was your post-op x-ray right after we took the teeth out back in February 4th. And so here we are, March, April, about like you said, about 8 weeks later, and your smile's gorgeous.
It is. I like it.
All right. So we'll see you in about a month just to double check everything, okay?
Okay. All right.
I know it's a little bit of a drive for you, but
I don't mind it. I just drive along, and I'm going to stop at the outlets today on my way back.
At the where?
At the outlets in
Oh, nice.
Waterloo.
Niagara Falls Outlet?
Yeah,
Oh, Waterloo?
so,
Okay.
I don't mind it at all.
All right. It's a pleasure taking care of you. We look forward to helping you in the future. Thank you. Thank you for joining me on the Monday Morning Minute. We'll see you next Monday.
Hi, I'm Dr. Sam Shatkin Jr. This coming May, on the weekend that they're going to be running the Shatkin F.I.R.S.T dental courses for the beginners, I'm also offering on May 16th a full-day Botox injection course. That course is going to include both didactic as well as hands-on. So if you want to learn how to do Botox and then actually physically perform Botox injections, predominantly on the face, you'll be able to learn about it in my course, get fully certified, and then it'll be the same weekend that Shatkin F.I.R.S.T is doing their beginner dental implant course. So it's a great chance for you to come in. Buffalo's beautiful in May. You're going to love the environment. We've got an amazing course set up for you, both for the dentistry and the dental implants, as well as the Botox course, which I'm going to be running on May 16th, which is a full-day course beginning at 8 a.m. and finishing around 3:30 to 4 p.m. Hope to see you there.
And remember, please join us to our 2-day One-Piece Implant Training course we have coming up on May 14th and 15th right here in Buffalo, New York. Come see Dr. Todd Shatkin, Dr. James Tharp, and a new guest lecturer, Dr. Boyd Shephard. Dr. Shephard specializes in critical topics that every practice owner should really understand, such as risk management, state board compliance, and record keeping. This is real-world practical knowledge you don't typically get in any clinical courses. Knowledge that can protect your license, your practice, and your future. Call today and reserve your spot for our May Introduction One-Piece Mini Implant Training Seminar on May 14th and 15th. Mention this Monday Morning Minute and save $200 off your tuition.